We're getting underway this afternoon at 5 with a live discussion with Governor Greg Abbott to get an update on where we're at right now and also where we're headed. Governor, thank you for joining us this afternoon. We do appreciate it. Let me dive right in, if I could. We did see the letter late this afternoon General Paxton wrote to Dallas County Judge Clay Jenkins, in summary basically saying the current orders that in Dallas County limit attendees at church, require all people over the age of 2 to wear a mask, and also the shelter-in-place order for the county. The letter says those are all unenforceable. Have you first heard from Judge Jenkins as far as a response, and what's your plan if he doesn't change his plan?
For one, I have not heard from the judge, but I also haven't seen the letter you're talking about. But here's the gist of what I understand, and that is there's an attempt to seek alignment between what the state has done and what the counties are doing, just to make sure that we are able to provide clarity for the public so the public understands exactly what the rules are they need to abide by.
So since we last talked also, I wanted to touch on this. There was a case in Dallas where you modified your executive order, as we know, and a woman who refused to close her salon, which was opened before it should have been, based on your state order, was released from jail after she was given 7 days, as you well know. So for as much support as she has gotten, at the same time, Governor, we've heard from countless business owners in and around that same area and across North Texas, to be honest, wondering what they're doing wrong, because they feel as though your move last week was a slap in the face. That's a term that they have used and asked me to share with you this afternoon. It's a slap in the face, they say, to all those who are complying with the order, trying to be the good people and the right people and doing it the way that you've asked them to. And she, I mentioned Katie Fairchild is one who is a salon owner. She and quite a number of others would like to know where is their support, and can you understand their frustration?
Sure, and perhaps some clarification will make it easier to understand. First, everyone has an obligation to make sure that they are doing their part to slow the spread of the coronavirus, and that means that the standards that we issue are standards that have been provided by doctors about what the safest practices are that people should abide by if they genuinely want to help keep their community safe. Second, what I did in my order was this. I made the determination that putting people behind bars is not the right solution. There are other penalties that exist that don't involve being put in jail. And so we're in a situation here where in Dallas County in particular, they are not putting people in jail who go out and steal things valued at $750 or less because the district attorney in Dallas says he's not going to prosecute them. Also, in some counties in Texas, I don't know if this is the case in Dallas County, they're saying, well, we shouldn't be putting people behind bars because there's a COVID-19 problem behind bars. And yet they put this woman behind bars. And so you can see, if you would, the inconsistencies in the criminal justice system in Dallas County. When there are inconsistencies like that, there needs to be predictability and certainty. One thing that is both predictable and certain is to have one standard. The second thing is fairness in the system. And when people are innocent victims of a pandemic who are just trying to get their stores up and running again, they may be subject to penalties or regulatory authorities, whatever the case may be. But I think putting them behind bars is not the right thing. And hence, that's why I altered my order, but I made it clear that it was the policy statewide, that putting people in jail is not one of the available solutions to resolve during the course of this pandemic.
Okay. Can you tell us tonight where you stand on bars and tattoo shops as well? Because you had asked for suggestions. We did a story just a few days ago with a bar owner who sent a rather lengthy list of suggestions for you and worked on that, took the time to do it. Where are you with bars and tattoo shops right now?
And it may be that person's suggestions I saw. I did see some good suggestions where basically the standard would be for bars somewhat similar to what we have in restaurants. So understand this. It makes a good argument, and that is, in restaurants, sometimes there are bars. In those bars and restaurants, they have the same seating requirements that the restaurant has. And so if restaurants are able to have bars open with seating limitations, why should bars not be able to abide by that same standard? So there's that issue, and then there's certain other ways that bars can be made safer. Note this, and that is the difference between a bar and a restaurant is that when people go to dine, you have a finite number of people to sit down at a table to dine together. At a bar, traditionally, is intended to be a mingling site where you have an unlimited number of people coming together and mingling together, and hence it poses a greater possibility of transmission of COVID-19. So all we're working on are some solutions that will be somewhat similar to restaurants to provide bars an opportunity to open up. We continue to work with our doctors on that who are advising us. Hopefully we will have an announcement we can make soon about bars being able to open.
Okay, and Governor, final question based on time here. You just brought up restaurants, so I'd like to ask you, a lot of restaurateurs are asking us to ask you, when we get to the 18th, do you think as of right now they may be able to go to the 50% occupancy, the phase 2, if you will?
So that's one of the issues I'm speaking to our medical advisors about tomorrow, to get guidance from them about what they are seeing and what their advice is. So my only hope is that people in Dallas, as well as the other parts of the state, will continue to do the distancing practices that are needed to hold down the spread of COVID-19, so that we will be able to provide these doctors with some really good-looking, compelling numbers about how COVID-19 is being contained in Texas.
Okay, Governor Greg Abbott, appreciate your time as always, answering at least a few of our viewer questions. We could sit and talk for an hour, but unfortunately we do have some other stories we want to get to.
I'll be back.
Governor, thank you once again. All right, good,
Thank you.
Good deal. We'll talk again soon.